Hi friends, today is the World Suicide Prevention Day, 10 September. Today I want to talk on suicide prevention. It's everybody's responsibility. But before going to my talk, I want to mention that today's theme in this year, theme is World Suicide Prevention Day's theme is creating hope through action. The aims it aims to inspire the confidence and the light in all of us that our action, no matter how big or small, may provide hope to those who are struggling. Preventing suicide is often possible, and you are the key player in its prevention. So, through action, you can make a difference to someone in their darkest moment as a member of the society, maybe as a child, as a parent, as a friend, as a colleague, or as a neighbor. We can all play a role in supporting those experience a suicidal crisis or those bereaved by suicide. Friends, now I am talking about the suicide. It's basically a global burden. If you see the epidemiological part, you know that more than 8 lakh people commit suicide every year. This means that every 40 seconds someone is committing suicide, and for every completed suicide, there are 20 people who are attempting to it. Suicide is the second leading cause of death for those between the age of 15 to 29 years. And the 75% of the suicide globally occur in low and middle income countries. Annual global standardized suicide rate is 11.4 per 1 lakh population. And for male, it is 15, and for female, it is 8. Though it is old data, but in May 2013, World Health Organization adopted the first ever mental health action plan. One of the goals being reducing the suicide by 10% in the countries by 2020. And the recent data shows that this target is reducing suicide by 30% in the countries by 2030. Now I want to narrate some key facts of suicide in the developed countries. The high rate in the people aged between the 15 to 24 years, and the risk is highest in the elderly population. Male are the most common. Male-female ratio is 3:1. And the divorced and widow people are at the higher risk. And 90% of the cases, those who commit suicide are associated with some psychiatric disorders. And if you see, the diagnosable depression is present in 70% cases. It's a huge amount. And most common method of suicide in developed countries are firearms, inhalation of car exhaust fumes, and poisoning. This is a pictorial presentation and graphical presentation where I am showing that in different states, the rate of suicide, if you see this, Andaman Nicobar has the highest, then Sikkim, Pondicherry, Chhattisgarh, Kerala, Telangana, Tripura, Tamil Nadu. These are the in the topmost suicidal rates in there. And if you see the lowest rate, it is Lakshadweep, Bihar, Manipur. So there is a variation of rate of suicide in different states. So socio-cultural factors are very important. Lifestyle definitely is one of the most important factor of committing suicide. And if you find out the etiological factor, family problems is the most important etiological factor, which constitutes about 32.4%. Different physical illness or other illnesses is constitute about 17.1% illness. And other causes are definitely substance abuse disorder, especially the alcohol, marriage related issues, any relationship related issues, love affairs, and also the financial issues like bankruptcy, job related issues, failure in the examination, professional career problems, unemployment is one of the important reasons, poverty, death of dear persons, property dispute, suspected illicit relation, as I mentioned, and fall in social reputation. These all the causes the somebody instigate someone to commit suicide. But the highest is definitely the family related problems, and next is illnesses. So, what are the key facts in India regarding suicide? You know that 75% of the global suicides are in developing countries. India and China accounts for almost 54%, that is more than half of the global suicides. And figures are likely to be higher due to underreporting. If you take the actual report, it is much more than that also. And the highest rate in the people aged less than 30 years. Male female ratio is 1.4 is to 1. In the developed countries, the male ratio is slightly less. And married women are at the higher risk, whereas in developed countries, widows are higher risk. And divorce, dowry, domestic violence definitely contribute a major role in suicide in India. And you know that psychiatric disorder associated in India, if you find out, it is about almost the same, 60 to 90% of cases. And depression is present in 35 to 40% cases in India and China. And most common method of suicide in India are quite different from the global scenario. Most common is ingestion of pesticides, hanging, self-immolations. And if you see the verbal autopsy studies, that reveals suicide rate is maybe the 6 to 9 times higher than the reported rates. So prevention is very important, and suicide prevention is not anyone's business. I mean, it's everybody's responsibility. Everybody should take care of it. As we know, the government should take an important role. Healthcare professional too. NGOs have a different and very important role in preventing suicide. All the individuals have role, and media is a very crucial role in preventing the suicide. So you cannot tell the government should take the full responsibility or health professionals should take the. It is a joint venture. Everybody should take a part in preventing suicides. Before that, you have to know what are the warning signs of suicide. Basically, if somebody is you are seeing that feeling of hopelessness, there is no hope in future, this talking like that. If somebody is feeling very isolated, feeling alone, different change of personality, like become very much aggressive or irritability suddenly, and they are possessing some lethal means, or feeling like a burden of this society or burden of the office or her family. There is a drastic mood changes you can if you notice, or somebody is suddenly starting talking about the death very much. If there is a signs and symptoms of self harm or like cutting behavior, if somebody is engaging oneself for some risky behavior, making funeral arrangements, if there is somebody is taking alcohol or any other substance, suddenly very much they started to taking, even somebody is giving some suicide threats. Sometimes we used to tell that those who are giving suicide threats, this is a basically attention seeking behavior. But my dear friends, don't do this. This is a really bad idea. If somebody is really threatening making suicide, you should be very much alert and give 100% care to that person. So how, what is the level of prevention? There are three levels basically. One is universal prevention strategies, which is directed to all individuals. Those strategies you can apply to anybody. And definitely second one is selective prevention strategies, which targets the vulnerable group based on their character, like age, sex, occupational status, family history. Maybe, and third one is indicated prevention strategies target specific vulnerable individuals who are harboring suicidal ideation or have attempted suicide, history of attempted suicide. These are the level of prevention, and you have to find out these risk factors. What are the risk factors associated with the health system and society. Number one important is barrier to the a barrier to access of the mental health care. Access to the means. Sometimes inappropriate media reporting is definitely one of the risk factors. And most important is the stigma associated with health seeking behavior. I'm feeling that I'm feeling depressed. I don't want to live more. I may anytime can commit suicide, but I'm not sharing this because of the stigma. This stigma, so stigma reduction is one of the most important part. And there are lots of intervention of the health system and the society also, like framing of the mental health policies. This is very important. And framing of the policies to reduce the harmful use of alcohol, one of the most important cause of committing suicide, and improving access to the mental health care. Though Mental Health Care Act 2017, it is everybody should get the access to the mental health care, but practically we should establish in reality. Responsible media reporting, one of the, we should talk to our journalist friends, raising the awareness about the mental health, substance use disorder, and the suicide. Because there are interrelationship in between this. This is very important. We have to take care of all this. And if you see the relationship, community, what are the risk factors? Definitely after any disaster, war, or conflict, there is chances of suicide is much more. Even in this pandemic period, there are studies where it shows that suicidal rate is very higher. Stresses of acculturation or dislocation, discrimination, trauma or abuse, especially the sexual trauma in the younger age group. Female is very common associated with suicidal attempt or committing suicide. Sense of isolation or lack of social support, relationship conflict, discord or loss, or sometimes it is very important sudden death of role model, idol, celebrity, as well as near and dear one. So intervention for community and relationship to risk factor is important. Intervention of vulnerable groups, gatekeeper training, and crisis center. So individually, you have to think if somebody has got previous suicidal attempt or having mental disorders like severe depression or schizophrenia like psychotic disorder, chronic psychotic disorder. If somebody is having harmful use of alcohol or other substance or sudden job or financial loss, which is very much common in this pandemic period, hopelessness, chronic pain and illness, because chronic pain and depression, there is a very good relationship in between these two, and definitely genetic loading like family history of suicide and other genetic and biological factors. Follow up and the community support is very important. Assessment and management of the suicidal behavior and assessment and management of the mental and substance use disorder. So you have to take care, you have to give importance in this area. Public awareness and education, like how to recognize suicidal risk, what are the warning signs as I discussed, risk factors of the suicidal behavior, role of underlying mental illness, reducing stigma and improving the health seeking behavior, direct role in reducing rates, suicide not found, definitely they improve the community attitude. So all these are very important because you have to make aware about and educate your people, educate the society about this suicide. If it is done, then definitely the rate of suicide will reduce a lot. One of the most important is restriction of access to the means, like access to pesticides. Remove locally the problematic pesticides from the agriculture practice. Regulation on sale of pesticides and introducing less toxic formulation. Another thing is regulation sale of barbiturates and benzodiazepines and restriction on access to alcohol also. It has an indirect benefit. And role of substitute method of after the restriction. Suddenly, if you do it restriction, then definitely we should take care of withdrawal syndrome and dependent syndrome, whatever it may be. That should be also, there should be a substitute method. The legal issues, there are lots of legal issues. I don't, as a different penal code and what is the rationale, the law act as a deterrent to suicide, and practically law act as a deterrent to the reporting. Hospital authorities to report accidental as necessary psychiatric help is deprived. There are lots of role, but the thing is that Mental Health Care Act 2017 has done a historical decision taken, that is decriminalization of the suicide. This is the guidelines on mental illness and the presentation of suicide. You know that it is 2019. And what I discussed, we told before also, the training of the primary care physicians is very important because 40 to 60% of the people who commit suicide are known to have seen physician in a month prior to. So general practitioner is very important role, because if you alert that anybody can suicide, if you keep in your mind, then definitely you can identify the people who has got suicidal ideations. And most of these have had contact with a general physician rather than a psychiatrist. Lack of skills for detecting depression and suicidality among the primary care physician often lead to suicidal death. So awareness training program is so important for the physicians also. Gatekeeper training. What is gatekeeper? Is anyone who is positioned to identify whether someone is going to do or going to commit or may contemplating the suicide. So the potential gatekeeper includes the primary, mental, and emergency health providers, and also the teachers and other school staffs. For students, teachers are spending more time than their parents with their students. Community leaders, police officers, firefighters are the first responders. Even spiritual and religious leader or traditional healer, they can also find out. Military officers. So training to them, gatekeeper training is very important. How to find out whether any people are going to commit suicide or planning or having suicidal ideation. So, what to do to develop the participants' knowledge, attitude, and skills for identifying individual at risk, determining the level of risk, referring at risk individual for the treatment. This model has been found effective in several institutions, popular in IITs also. Practically beneficial, direct link to decreased suicidality remains to be tested. So, what is the role of mental health care professional? You know that psychotropic drugs and suicide, there is a direct relation. Monitoring for antidepressant induced suicidal ideation need to be done for the first 2 to 4 weeks, especially the adolescents and young adults. Though there is lots of controversies in this area, there are different studies, recent studies shows like that, but definitely antidepressant you have to write if the patient have severe depression. Psychotherapy and suicide is an important area where we should learn, we should consult, and the post intervention support for those bereaved or affected by suicide, and follow up care after the suicidal attempt. And definitely, it is very important the role of media. It may I come last, but it is not the least. It is one of the most important part. Further effect of copycat suicide, you know that responsible media reporting may be actually have a positive impact on suicidal behavior. Papageno effect. Guideline on media reporting of suicides are issued by WHO, World Health Organization, and updated periodically. So media should follow that. Not even that, Indian Psychiatric Society published its position statement and guideline on media coverage suicide in 2014, which is also basically on depending on the WHO report, and avoid language sensationalization or normalize the suicide or present it as a solution to problems. Avoid prominent placement and undue repetition of the stories about the suicide. Avoid explicit description of method which is used in a completed or attempted suicide. Avoid providing detailed information about the site of completed or attempted suicide, even the photographs. This is also important. Word you should use very carefully, especially the headline words. Exercise caution in using the photographs and video footage. Show due consideration for the people bereaved by suicide. Provide information about where to seek help if somebody is feeling suicidal ideation or feeling to commit suicide, where they will go, how to seek help. Take the opportunity to educate the public about the suicide. Vulnerable period is usually 30 days from the publication of the news, but the maximum effect is in the first 3 days and leveling off in 2 weeks. Avoid hyperlinking of the suicidal material on the social media, very important. And provision of a health center with frequently asked questions on suicide. And role of NGO, non-government organization, is very important because inadequate mental health professionals, dwindling of existing family support system due to rapid social changes. So NGO can bridge the gap to an extent. Befriending the suicide attempter may subsequently encourage them to seek professional help. At least they can tell somebody what is their feeling, how they are thinking, what are, if they have suicidal ideation, they can share with somebody else. Organizing awareness program, educating gatekeeper is a very important role regarding NGOs. Some NGOs also run a suicide helpline for high risk individuals like Sneha, which is actually led by Dr. Lakshmi Vijay Kumar. And the performance of NGOs, there are other NGOs also are suicide helpline there. I'll talk later on. And the performance of NGOs need to be monitored and evaluated, whether they are in the directly what they are doing. They should consult with the expert people, maybe the psychiatrist, psychologist. They should get the help, and whatever they do, according to science, according to evidence-based studies, they have to follow the rules. What are the most effective interventions then? Physician training and education, most and most important. Means restriction, controlling the media, gatekeeper training, and suicide prevention intervention should be multimodal and evidence-based, including the intervention at various levels. Towards the national strategy for suicidal prevention, you know that community intervention is very important, increasing the public awareness campaign to reduce stigma. Again, stigma is a very important factor. So you have to fight against stigma. Guideline for mass media, legal issues related to suicidal attempt, regulating formulation, packaging, and the sale of pesticides, OTC medicines, gender related legislation, and the action. Intervention at the institutional and organizational level, definitely it increases the specific clinical training programs for lay counselors, readdressing the curriculum for the medical and nursing personnels, intervention program for the high schools, and definitely other individual levels intervention should be needed, and the development and evaluation of the programs. So, in conclusion, suicide prevention strategies can be universal, selective, and indicated. According to strategies may be employed at level of government and society. For national responses to be effective, comprehensive, multi-sectorial suicide prevention strategy is needed. The entire community has to play a critical role in suicide prevention by providing a social support to the vulnerable individual, fighting stigma, and supporting those bereaved by suicide. And one good news, we are very much on behalf of Indian Psychiatric Society introducing very soon a suicidal helpline. We hope that that will definitely take an important role in reducing suicide in our society. Thank you. Thank you so much for the patience here.